Hello, this is Dr. Andre Broussard speaking, and I'm just making a little video today to help my patients be aware of the possibility. It's a small risk, but it's a real risk that I think a lot of doctors aren't telling their patients about a type of a fracture that's happening in people that take osteoporosis medications. A lot of the osteoporosis medications are called bisphosphonates, and what's happening is that they're finding that there is a small but a real risk of leg fractures. Okay, let's look at here's a picture of an x-ray, and right over here is going to be the ball and socket joint portion of the leg. Right off of the ball and socket portion joint, you have this bone, the thigh bone right over here, called the femur. And what's happening is that people's legs are breaking right over here, one side or sometimes both sides at the same time, after long-term use of taking this class of drug called the bisphosphonate. Okay? Now, the way that the bisphosphonates works is, well, kind of like this. Let's go take a look at this slide over here. Now, normally, the way that you see, bone is a living tissue, basically. I want you to think of your skin. Your skin cells are constantly sloughing off. The old, dried, dead skin cells slough off, and then your skin produces new, fresh, new skin underneath. Now, the bones do the same thing. They have a set of cells called osteoblasts, and they produce the new bone cells. Then you have a set of cells called the osteoclasts that resorb the old dead bone and gets rid of it for you. Okay, so that way there's constant bone turnover. Now, the way that the medication works is like this. Let's say that these are the little bones called the osteoblasts, and they make the new bone. Okay, right over here on the top, and then underneath the surface over here, let's call these the osteoclasts. Let's say that these clean up the old dead bone and get rid of it. What the medication does is it stops these cells from doing their job, from cleaning up the old bone. Okay, stops the resorption of the old bone. And so what happens is that you start having a backup of the old bone, the old dead bone cells, deep inside of your bones. Okay, so that starts to fill up inside of the bone like this. And the next time that they take an x-ray, it's going to appear denser on the x-ray film. So it looks like it's actually making the bone denser, but it's not necessarily making it stronger. At least that's my personal prediction of what they're going to find out about these medications in the long run. It makes it look denser on the film, but I don't think it's going to necessarily make it stronger. And that's why we're seeing these types of fractures happening in the leg. Now, this was published in February of 2011, and there was in the Journal of the American Medical Association, February 23rd, 2011. And this article is entitled Bisphosphonate Use and the Risk of Subtrochanteric or Femoral Shaft Fractures in Older Women. Now, it mentions women over here, but I think that the medication, since it's going to work the same thing in men, that's another thing us guys need to watch out for as well. Now, 2 years prior to that, in this journal called Geriatrics, there was another study, and this one was entitled Bisphosphonates and Low Impact Femoral Fractures. But that's what they were finding, was that these bisphosphonates, especially the alendronate fracture risk. Okay, right over here they show an x-ray of a person that broke that leg right underneath the ball and socket joint right over there from taking the medication for a long period of time. And that's the kind of thing that I just want to make my patients aware of for right now. And then, okay, the last thing that I want to talk about is another thing that they're finding with these medications is that the bisphosphonate drugs, okay, there's another small chance if when you use these bisphosphonates, there's a condition called osteonecrosis of the jawbone. Okay, basically what's happening is that when you take these drugs for a certain dosage for over a certain period of time, and in certain period it starts to rot the jawbones off. Okay, now we don't know why it chooses the jaw yet, but that's another thing that we're finding about these bisphosphonate medications. Okay, and in this particular article in the Cleveland Clinic Journal of Medicine, they actually listed out the different medications and the dosages, etc., about all of the different osteoporosis medications and your risk of osteonecrosis of the jaw. So that's just another thing that you just need to be aware of whenever, if you're on these bisphosphonate drugs or the osteoporosis medications, please let your dentist know. Okay, because some of the procedures, they might want to get you off of the medication for a period of time before they work on your teeth or your gums. Okay, so I think that might be helpful for you to know as well. Okay, this is Dr. Broussard. I'm just trying to keep you up to date. Not trying to scare you, just trying to keep you up to date and what to watch out for. If you're interested in any alternatives as to how to improve not only the density but the strength of your bones, there might be other different alternatives. And if you're interested in something like that, please let me know.